Hey everyone, I just wanted to hop on here to record this quick video on using eccentric exercises to increase range of motion and improve flexibility. So in the last about 2 months, I've started to dabble way more with strength training into my practice. So most of my patients are getting more, so I have this strength bias and most of my patients are getting more strengthening exercises, more eccentric loading, of course within reason. And I find a lot of times using eccentric strengthening can also help increase range of motion. And I tend to use that a lot for, say, overhead motions. So if you find some of your patients are stuck in this position, they can't really get their arms fully into a full overhead position, or they're lacking that end range of shoulder flexion, instead of doing those classic lat stretches where you're doing those static stretches and holding it for about anywhere 30 seconds to a minute for long periods of time, if you're not a big fan of that, you may want to try this one here. So in some of my previous videos, I did make this one video on the ball and stick exercise, which is a great spinal mobility exercise, and it helps kind of loosen up the shoulders as well. If you haven't seen that, I'm going to add the link to that in the comment section here. However, I wanted to show you an advanced version or a progression of that exercise where we can start to now incorporate some eccentrics into the training there. So to do that, we need a stick, we need some weights. So I'm going to wrap this kind of 5-pound weight, ankle weight, across the stick here. And then we're going to perform that same exercise with this. So just adding a weight to the stick actually makes it kind of unstable, and it makes a lot of your muscles now fire to stabilize this. So that's why I really like to incorporate. If some of my patients have done that previous exercise and they are fairly confident, now we need to start loading them up, and this is how I like to do it. So let me set up the whole exercise for you. I'm going to bring this down a bit here. Okay, and the classic setup of the exercise, if you've seen the video before, you may know, is we get the ball in that position, right? In this, let's just check overhead movements right now, right? So I'd say comfortably I can go up till here, right? So almost full but not exactly. And now to execute this exercise, we are getting, I'm going to place my feet on the ball, hold the stick up right there, right? And then start to pull my knees towards my chest. And as I do that, I start to bring that bar overhead close to the floor. And then back. Good. And repeat this process. And slowly bring it back up. Now I'm careful to go really slow with the eccentric part of this exercise, where I'm trying to slowly bring this bar overhead. And back. Now you want to load this exercise appropriately. You want to make sure that you start with your, especially with your geriatrics and older patients, you want to start slow. But oftentimes we tend to underload our patients, and that's something you want to be a bit cognizant about. If you find you're not getting enough the best results with this exercise, maybe you might be going slightly light with your weights. So try to load up appropriately. Now I have a feeling this might not be the best weight for me, but we'll see if we can make any of those lat changes with this exercise. Back, and the last one. Right. Okay, now let's check this again. So in this position, try to raise my arms up, and that's comfortable for me.